There may be significant cancer-fighting properties in a common drug many of you likely have in your cupboards right now. The research suggests taking aspirin daily can be used to prevent and treat cancer. So, should you start popping an aspirin every day? CBC medical specialist Dr. Karl Kabasele joins me now with the details. First of all, let's talk about the research a little bit more. What does it say?
Well, this is sort of building on the idea that they have found, almost by accident, that taking aspirin seems to reduce the risk of cancer, of a variety of cancers, but in particular, cancers of the gastrointestinal system, like colon cancer. And there's also some evidence that taking aspirin can reduce the spread of cancer. So what we call metastases, which really, once cancer begins to spread, it becomes more difficult to treat. So if you can find a way to stop it, that would be very useful. So this research sort of reviewed existing research, put it all together, and by doing that, you sort of increase the statistical power of the research, and they found that, yes, there was a statistically significant protective effect of aspirin, but really after 5 years, after taking it for 5 years.
Okay. So a lot of people might be in that position of taking it for 5 years because they might already be taking it because it already, people take it to anti-inflammatory.
Anti-inflammatory or platelets to stop clotting.
Right.
So if you have heart disease, for example, your doctor might put you on a junior or baby aspirin just to reduce the risk of clots. So there are people, yes, who are already taking it on the advice of their doctor. And I think that's a key point we have to make here, that this is interesting research, but it's not to say that everybody should run out and start taking aspirin, because there are downsides, there are side effects, including the increased risk of bleeding. So as you can imagine, aspirin is a medication that reduces the risk of clotting by reducing your blood's ability to bleed. So we know, for example, that people who take aspirin are more likely to get bleeds in their brain, which can be life-threatening.
Okay. What is it about aspirin, though, that makes it such a catch-all and apparently a great drug for a lot of different big-time killers?
Well, I think that's something that's still being understood when it comes to cancer. But some of the theories are that because of its anti-inflammatory properties, we're understanding more and more the role of inflammation in cancer. And so because it sort of stops a certain cascade of factors from happening in terms of clotting, we think that perhaps there's some effect also on cancer or on tumors, and then also on its ability to spread. So it may sort of enhance your body's ability to kill off cells that are unhealthy, like cancer cells.
Now, you mentioned that there's some danger if you're prone to bleeding, for example, that you should talk to your doctor about taking it.
Right.
But is there such a thing as overdosing on cancer? Sorry, yes, there is on cancer.
Yes.
On aspirin?
On aspirin, absolutely, yeah. So if you take too much of it, obviously there are the risks of more bleeding or bleeding when it's not appropriate. So basically taking away your ability to clot, because clotting is important. You cut your knee or your finger or what have you, and the platelets play an important role in stopping that. So if you're on aspirin on a high dose or a dose that's too high, you can eliminate that problem. We also know that aspirin and drugs like it can have an effect on the lining of the stomach and therefore increase your risk for ulcers and gastritis, that's inflammation of the stomach. So yes, it is possible to take too much aspirin.
All right, well, we'll leave it there. I guess consult your doctor is always where we end these interviews.
Yes.
Dr. Karl, good to consult you. Thank you very much.
Thank you.
Okay, CBC medical specialist Dr. Karl Kabasele.